Wonderful. Hello, everyone. We will go ahead and call to order the statewide substance use response working groups treatment and recovery subcommittee meeting. Great to see everyone. Before we proceed, we will do roll call to establish quorum. So I will turn it over to Kelly Marshall to take roll.
Thank you, Chair Shell. Chelsea Cheatham.
Present.
Dr. Dixon.
Here.
Steve Shell.
Here.
Jeffrey Iverson. Dorothy Edwards.
I'm here, thank you.
Mr. Chair, we have a quorum.
Okay, great. Thank you, Kelly. Item number 2 on our agenda is public comment. Please bear with me as I make a brief statement and then we will open it up to public comment. Public comment will be received via the Zoom meeting. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. So on that note, Kelly, do you see anyone wishing to make public comment?
You're muted, Kel.
Kelly Marshall for the record. No, Mr. Chair, I don't. However, let me just read the dialing in instructions. So if you're dialing in from a telephone, please dial 253-205-0468. And when prompted, please enter the meeting ID 894-893-75298 and press *6 so that we can prompt you to unmute. So we'll give a moment for anyone to respond to that. And Chair Shell, I do not see anyone requesting to make public comment.
Okay, thank you, Kelly. That will conclude item number 2. Moving on to item number 3 on the agenda. This is a review and approval of our minutes from our meeting that was held on November 5th, 2024. So hopefully all of our subcommittee members have had a chance to review those minutes. And if so, we can entertain a motion to approve.
I so move. This is Dorothy.
Thank you, Dorothy. Do we have a second?
I'll second it. I haven't had a chance to review them, though.
Thank you, Dr. Dixon.
Uh-huh.
Do we have any discussion regarding the minutes? Hearing none, all those in favor of approving our minutes, please say aye.
Aye.
Any opposed? Motion carries unanimously. Thank you. Moving on to item number 4 on our agenda. This is our 2025 subcommittee reorientation. Just wanted to remind our subcommittee members of a few items that I know are very important to Attorney General Ford and his team. Since March 2024, attendance has been tracked, and any member who goes below a 75% attendance rate for either a subcommittee or the full SURG working group meetings will be asked if they wish to continue serving. If you cannot attend a meeting, please email the SEI staff at least 4 business days in advance to ensure a quorum or rescheduling of the meeting if necessary. And I think our group did very well in this last year. From what I remember, I think we had very good attendance. I know we want to work very diligently this year to maintain that again. I know that's very important, not only to our subcommittee, but also to the full SURG meetings that are also scheduled this year. So on that note, does anyone on our subcommittee have any questions or comments regarding attendance or anything else to add, Kelly?
No, Kelly Marshall for the record, I would just note that Mr. Iverson did contact me this morning to let me know he had surgery this morning and would not be able to be at the meeting today.
Thank you, Kelly. Anyone else on our subcommittee wishing to make any comment about attendance? Okay, moving on to recommendations. As those of you on our subcommittee are aware of, recommendations have been very critical to this SURG, the full SURG working group. And it's very important for our subcommittee to make recommendations in this process to take forward to the full surge as we did in previous years, particularly in this last year. So that's going to be very important for us again this year to think about what we want to recommend to the full surge working group. So very shortly, the SEI staff will be sending us a survey in what's called Survey Monkey. I think everyone is probably familiar with this process as we did this last year. But we want to encourage all of our members to submit recommendations, even if they are not fully developed yet. It doesn't necessarily have to be a fully developed idea at the moment. We would just encourage you to submit that recommendation so that it can be placed on a future subcommittee meeting agenda. And then our subcommittee meetings will be used to discuss and refine the recommendations. So even if you're not quite sure where you want to take your recommendation, at least submit it, and then we as a group can talk about that and refine it, and then figure out as a group if we want to propose to move that forward. And then the SEI team will be sharing this link throughout the year as well. To ensure that subcommittee members have adequate time to review recommendations before meetings, please submit all of your recommendations at least 1 week in advance. And that will give the rest of us, a chance to be able to review and be prepared for our meetings. For example, for the May meeting, our next meeting in May, staff will need to submit materials to members on May 13th. So if you have any recommendations to make, please get those in, before May 13th so that we can get those onto the agenda. Kelly, anything else you might want to add there to the recommendations?
So Kelly Marshall for the record. Thank you, Mr. Chair. So I'm sharing right now what the survey looks like. Can you see that on my screen?
No.
With the names of the committee members?
No.
Not yet, Kelly, no.
Okay, let me stop sharing and see if I can reshare that. I also put in the chat the link. I would just note this link is for subcommittee members only. So if you're not a subcommittee member, you cannot submit a link. I will send the link out to, or a recommendation. I will send the link back out to the subcommittee members. But you can see that here is the list of subcommittee members. You click your name, you hit next, and then you submit a recommendation. This is the same format we've used for the last 3 years. And as Chair Shell indicated, I would say strongly recommend that if you're able, you submit even a partially developed recommendation so that we can determine if there are questions from the subcommittee, if there are things they would like to request in terms of data or a presentation that will allow you to further and fully develop recommendations. And on that note, I'm going to stop my share and reshare so that you can see the PowerPoint. Okay.
Okay, thank you, Kelly. Does anyone on our subcommittee have any questions regarding the recommendations process? And just as a reminder, we're encouraging our subcommittee members to submit at least one recommendation this year. So hopefully we all have ideas already that we can begin to formulate and bring forward. Okay, if there aren't any other questions or comments regarding recommendations, we will move on to item number 5 in our agenda. This is a review of AB 374, Section 10 requirements and subpopulations addressed in the 2024 recommendations. Just to give a recap, and I'm not sure, Kelly, was I going to have Terry do this section, or? I saw Terry's name on the previous, Ms. Kearns on the previous slide.
Excuse me. Oh, I think
Oh,
that
there
is
we go.
that is just an error from a different subcommittee that did not get caught. Sorry about that.
Okay, that's okay. That's no worries. I didn't want to put Ms. Kearns on the spot, so thank you. So just to give everyone a recap of our recommendations from 2024, I'll just go through these quickly. So our first recommendation was Legislation should be considered to amend the NRS pertaining to the Nevada Bureau of Healthcare Quality and Compliance's employment guidelines for hospitals, including behavioral health hospitals, to hire certified peer recovery support specialists who have felony backgrounds and are within 3 years of their last felony conviction. It was recommended that individuals who were convicted of drug offenses or other offenses that do not involve violent acts or sexual exploitation be considered for employment as certified peer recovery support specialists in hospitals. So that was our first recommendation, that one of the 4 recommendations that we moved forward. Number 2, as you will see, is to support BDR 95 to ensure opioid antagonists must be available on all campuses under our Nevada system for higher education, including in student unions, health centers, all levels of the dormitories, residential advisors, domiciles, sports facilities, and libraries, and include training of the administration of opioid antagonists, which can take place during online freshman orientations, much like we already disseminate information about Title IX during orientation week. Training could be offered throughout the year by various clubs and programs within each institution's design. Our third recommendation was to support access and linkage for treatment of trauma for people with substance use disorder or those who have overdosed, and for surviving family members after an overdose fatality, and to support training for healthcare professionals to identify and address trauma. And then our fourth recommendation was to direct Nevada's Division of Public and Behavioral Health to identify a funding mechanism for hospitals and providers to enhance the Bridge program for emergency departments by incorporating peer recovery support specialists into their treatment models, and to support the use of peer support navigators via telehealth to increase access to treatment and support for individuals identified in emergency departments. So those were the 4 recommendations that our subcommittee approved to move forward to the full surge, and that also appear in the 2024 annual report. So on that note, do any of our subcommittee members have any questions or comments regarding any of these recommendations? I will note that I think that, and I don't know if anybody else wants to add to this, but I think what we proposed last year were very solid recommendations. I know a lot of us were very proud of what we actually, vetted and moved forward. So hopefully we'll be seeing something come out of these recommendations in the very near future. Kelly, anything else to add to that section?
No, thank you.
Okay, great. Thank you. Okay, so that will conclude item number 5. We will now move on to item number 6. This is planning for the 2025 Treatment and Recovery Subcommittee meetings.
Sorry, I think there are slides that should be hidden that are not. So I do think we want to talk about legislative language and treatment and recovery subcommittee assignments, as noted here.
Thank you, Kelly. So these are specific items that our subcommittee has been tasked with considering this year as part of, what we want to actually recommend to the full search committee. So I'll just go through each one of these quickly. The first is assess and evaluate existing pathways to treatment and recovery for persons with substance use disorders, including, without limitation, such persons who are members of special populations. The next item, evaluate ways to improve and expand evidence-based or evidence-informed programs, procedures, and strategies to treat and support recovery from opioid use disorder and any co-occurring substance use disorder, including without limitation among members of special populations. And the third there, examine support systems and programs for persons who are in recovery from opioid use disorder and any co-occurring substance use disorder. So again, these are the items that the areas of interest that have been assigned to our subcommittee, and then hopefully the recommendations we bring forward will speak to these items here. So do any of our subcommittee members have any questions or comments? Okay, moving on to the next slide here, there are a couple of other items that have also been assigned to us. The first there is assess evidence-based strategies for preventing substance use and intervening to stop substance use, including without limitation the use of heroin, other synthetic and non-synthetic opioids and stimulants. Such strategies must include, without limitation, strategies to help persons at risk of a substance use disorder avoid developing a substance use disorder, and discover potentially problematic substance use in a person and intervene before the person develops a substance use disorder, and examine qualitative and quantitative data to understand the risk factors that contribute to substance use and the rates of substance use and substance use disorders, focusing on special populations. And I think, Kelly, that concludes the assignments to our committee. Oh, I'm sorry. We have one last assignment there. Study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of money described in Section 10.5 of this Act to address substance use disorders, with a focus on the use of the money described in subsections 1, 2, and 3 of Section 10.5 of this Act to supplement rather than supplant existing state or local spending, the use of the money described in Section 10.5 of this Act to support programs that use evidence-based interventions, the use of the money described in Section 10.5 of this Act to support programs for the prevention of substance use disorders in youth, the use of the money described in Section 10.5 of this Act to improve racial equity, and reporting by state and local agencies to the public concerning the funding of programs to address substance misuse and substance use disorders. And I think that concluded the assignments, if I'm correct, Kelly. Okay. So I know that was quite a bit for me to get through and read, but on that note, though, again, those are the specific areas that have been assigned to our subcommittee to review and consider. So on that note, I wanted to open it up to our subcommittee members for any thoughts at this point regarding any of these assignments. So again, hopefully each of us will have at least one recommendation to bring forth to our subcommittee here to consider for possible recommendation to the full SURG committee.
So, Mr. Chair, Kelly Marshall for the record, I just wanted to note that based on the letters you just referenced and the assignments, we did an analysis from 2022 through 2024 to see how many of the total recommendations brought forward by this subcommittee addressed those specific elements. So element C or E or F or B or H or Q, as you just shared with the subcommittee. And so you can see that not every element was addressed in every recommendation every year or at all in every year, but over time, over the last 3 years, you can see 10 of the recommendations were around area E and only 1 was around area H. And so if I go back to E, you can see that that was most of our recommendations have come around ways to improve and expand evidence-based or evidence-informed programs, procedures, and strategies to treat and support recovery. So that the bulk of our recommendations have come in that regard, which makes sense because the name of the subcommittee is the Treatment and Recovery Subcommittee. So that is a clear focus. If we look at H, examine qualitative and quantitative data to understand the risk factors that contribute to substance use and rates of substance use and substance use disorders, focusing on special populations. That has fewer, in fact, only one recommendation. That was a recommendation that came out of 2024. And then everything else is pretty evenly split. Either 5 or 6 recommendations have been brought forward that address that component. And just a reminder that many of your recommendations address multiple components. So they could address E and F, or E and C, or E and B. So this was just a way to chart to give the subcommittee a retrospective on what has been done thus far. And then we have additional, excuse me, I don't know why my finger is so quick on the draw today. But if you wanted to see specifically the number of times a recommendation aligned, this is the number of times they aligned for treatment and recovery, not for response, but for treatment and recovery. So there you see item E, then you see item C, which is the existing pathways to treatment and recovery, assessing and evaluating them, examining support systems and programs for people in recovery, has had 6 recommendations. And then if we look at overall B, the number of times components aligned with the overall SURG recommendations, you have 26 times for B, 17 times for Q, 6 times for H. And then this is a summary of the special population. So remember that we also are trying to address special populations as written in the legislation, including veterans, elderly populations, and youth, persons who are involved in the criminal justice or juvenile systems, pregnant women and the parents of dependent children, excuse me, lesbian, gay, bisexual, transgender, and questioning people, people who inject drugs, children who are involved with the child welfare system, and then other populations overly impacted by substance use disorder. And so you can see the total number in bold for 2023 by subpopulation, then you can see it again for 2024. Then you see the total combined, and you can see the total number of times a treatment and recovery recommendation addressed those populations. So it gives you a sense that this subcommittee has been incorporating that. If you think back to some of our recommendations, they've explicitly called out Black, Indigenous, and people of color, or there were recommendations specifically around pregnant and parenting people and their children. We've had recommendations around the child welfare system. We've had recommendations around people who inject drugs. And obviously the criminal justice system as well. So this just gives you a sense of the work that's been done to date that would then allow us to move forward with planning for the treatment and recovery subcommittee meetings in 2025, which would be your agenda item 6. But I wanted to pause there, Chair Shell, and just share this information that the SEI team put together as an analysis of the different recommendations by subcommittee, because we thought that would help inform. And I'm happy to go back to any of the previous slides if any of the subcommittee members would like to drill into something further.
Kelly, thank you for that. This was very helpful. So again, as Kelly just mentioned, any of our subcommittee members have any questions or comments regarding these areas?
Chair Shell, Kelly Marshall for the record. I'd be interested if this information is helpful for the subcommittee.
Or
Is this
relationships,
information?
hopes, dreams, financial stability, something that really comes up for people is those insurance.
I think somebody just wasn't muted and might have been on two different Zoom calls at the same time. So again, Kelly Marshall for the record. I would be interested to hear from the subcommittee if this information is helpful and if this is something you would like depicted at the beginning of the subcommittee season again, moving forward.
Kelly, this is Steve. I'm curious to see what our other subcommittee members, how they feel, but I do think it's helpful, especially to see where our past recommendations have fallen into these these certain areas. I do think that helps kind of direct us for the coming year, but I'm anxious to hear what our other subcommittee members think.
This is Chelsea Cheatham for the record. I think this is really helpful. I agree with Chair Shell that it helps us. I'm sure this is going to help me for this upcoming year to be able to see, to ensure that we're talking about all of the special populations that are impacted and to see where we may have not focused in the past, so that we can focus on our recommendations on some of these other special populations in this year. So this is very helpful. I would like to see this in upcoming years as well.
Thank you.
Yeah, thank you, Chelsea. Anyone else have any comments?
This is Dorothy. I
Yes,
find
dear.
this very helpful and interesting. I may have missed it and I apologize. Other populations, do we have someplace in a slide that talks about what those are, just for future use? And I think as we move through these uncertain times, I think knowing the data on certain groups in our vulnerable populations may be helpful as well. So that's just kind of what leapt out for me.
Kelly, any thoughts on that?
Chair Shell, Kelly Marshall for the record. I will go back to the legislation and double check to see what other populations were explicitly listed. I wanted to note that I thought there was a section. Just going back to the actual language of the legislation. Yeah, I don't see it here, Ms. Edwards, so let us dig back into that and then we can follow up with you, or I would ask our resident researcher, Laura Hale, if she wants to pull up the language to see if there is any more information specific to that last column of other populations overly impacted by substance use disorder that further defines it.
Yep, just look and I'll let you know.
Okay, thank you.
I see Dr. Dixon with her hand raised.
Yeah, hi, Dr. Dixon for the record. So two things. One is we are having a tremendous wind down here and my connection's unstable, so I've missed a lot of what's been said. But anyway, what I would like to see us do with this data is, these numbers, is look at the real data about who is actually dying of overdose, opioid induced overdose deaths in these special populations. I mean, the fact that we mention them is great, but I don't know if it's related to the data. And we've got the Clark County opioid task force that's hopefully collected some data down here anyway. And there's probably some state data too.
And Chair Shell, if I may, Kelly
Yes,
Marshall.
please, Kelly.
I would note that one of the populations, just to answer my own question, back to Dorothy Edwards' question about other populations overly impacted. We do know that there are sometimes racial and other sociodemographic differences. For example, people living in poverty may be more greatly impacted just because of the health environment that they live in or don't. And I see Dr. Kearns raising her hand as well. So Dr. Kearns, please correct anything I misstated, but I believe that's one example of other populations.
Yeah, those are all good. I don't think that it specifically calls it out in AB 374, but one thing I would note, and Dr. Dixon's comments about the Clark County Task Force reminded me that in theirs, they talked about overdose deaths and heat-related issues and the high incidence they were seeing. So that, in my mind, is another population overly impacted as related to the heat. So I just wanted to highlight that. And I'll bring it up a little later, but I just wanted to tell everyone that this information I find really useful. This really helped when we were doing some testimony about how we break out our work, who looks at what. The whole SURG isn't looking at everything, that they were broken out, and the different subcommittees look at the different, that A through Q, so that we're not duplicating work. We do sometimes have a subcommittee that will make a similar, and we combine those. So this becomes really important when we're especially talking to the legislators, but I'll get into it a little more later.
Thank you, Dr. Kearns. I see Laura Hale with her hand raised.
Yeah, just to confirm that Dr. Kearns and others are correct. The legislation does not specify it. The language says other populations disproportionately impacted by substance use disorder. So they just want to have that as a open category that members can identify.
Great. Thank you, Laura.
All right.
Kelly, any other comments to wrap this up? Okay. Thank you, Kelly. Moving on to our next slide, Kelly's. There we go. Okay. So item number 6 on our agenda is planning for 2025 treatment and recovery subcommittee meetings. We certainly wanted to open it up for discussion today, regarding any topics for our future meetings, regarding, what would our subcommittee like to accomplish this year? So starting with that question, we wanted to open it up to a general discussion with all of our subcommittee members about what is it you would like to see us accomplish this year. This, just to note that our subcommittee members are the same as who we had in 2024. So we have not added any new members. So I'm curious to see if any of our subcommittee members would like to see something different this year or accomplish something different. So on that note, I will open it up to all of our committee members.
This is Dr. Dixon. I agree that we've got the same members, but is there any way we can know who all these other people are that are on our that are listening in?
Possibly, Kelly.
I would,
know
Kelly Marshall for the record. I would ask our esteemed Dag to weigh in. Joseph, I don't know if you have an opinion about that.
I mean,
Um,
it's a
people
public, sorry, I didn't mean to
chat.
interrupt, Judge. Well, I'm sorry, I didn't mean to interrupt you. What were you saying, Kelly?
No, I just wondered if you could give us some guidance related.
So it's a public meeting, anybody can join. You can ask for people to identify themselves, but I don't think you can force them. That's my advice moving forward.
So Joseph, if we wanted people to introduce themselves in the chat, would that be an appropriate use of the chat in a public meeting?
That would be fine, yeah, there's nothing wrong with that. But you can't kick people out for not identifying themselves.
Excuse me, Mr. Estuno, in the past, we have avoided using chats for people who are on the phone because they don't have access to that. And we do have someone on the phone.
Yeah, I did see that. I honestly, I don't have an opinion of that. They can ask for a copy of what was in the chat. Well, actually, let me ask staff. Can the person on the phone request a copy of what was presented in the chat at a later time? Or I don't really see
Yes.
that. They can.
Yeah, so Kelly Marshall, for the record, we do keep a transcript of the chat and it can be attached to the meeting minutes.
Then I don't have a problem with that.
I'm not meant to be discouraging or anything. I'm just curious who's interested in what we're talking about, since nobody has volunteered to do public comment. I'm just curious why they're interested, and if they have something they would like to suggest to us.
You know, I would recommend maybe at the beginning of the meeting, moving forward, like at the next meeting, maybe having, or at least having staff attempt to reach out to each person in the meeting and see if they're willing to identify themselves. And you can ask them questions if you guys want, but like I said, they don't have to answer them. It's a public meeting.
Does that suffice for you, Dr. Dixon? I mean, that sounds like a
Yeah.
good recommendation to me.
Yeah, okay, sure.
Okay, thank you.
I mean, I guess my real idea here is I'm not sure what it is we want to accomplish, because I'm not sure what we want to accomplish. I'm not sure where we're going anymore. Another question I was going to ask is, I know we've had reports before of what has been turned into legislative and what recommendations have been, but do we feel like what we have done so far has made any impact on the problem of substance abuse in our communities?
Well, on that note, I see Laura Hale with her hand raised. Laura?
Thank you, Chair Shell. I was on the response subcommittee meeting last week with Dr. Kearns, and this same kind of question came up with that group wanting to know what's the impact of recommendations that have been made so far. And we did have a report out in October from the Department of Health and Human Services and their different divisions that work on a lot of these things. So they did provide some updates, and they will again later this year. We also will have a report to the SURG in April, the larger SURG, with a status report on legislation that may be of interest to SURG members. So we do try to let members know. And so just to Dr. Dixon's point, it is good to know. We've been making recommendations, or you've been making recommendations for 3 years. What is the status of those, and does it imply updates to those recommendations in this current year? Or, you don't necessarily have to come up with a whole new slate of things every year, because it's a big problem and there are big recommendations and things happen over time. Hope that helps.
This is Steve. I appreciate you bringing that up, Dr. Dixon. I think, I especially feel the same as you too. I think we all want to know, have the recommendations we've been moving forward, making a difference in any kind of way or being addressed beyond, the full surge. But I think like Dr. Kearns and Laura Hale just mentioned that, we should be hearing a little bit more of that in some of the future and the subsequent surge meetings. Hopefully we'll get more answers around that.
So this is Dr. Dixon again. So one of the reasons I'm saying that right now is that although there was yesterday in the legislature, which was the last day to present new bills, the Psych Association, we have an active team following the bills, and there's been hardly anything related to substance abuse presented so far. And the question is, were there some things that we and all four of the subcommittees have recommended that maybe could have gone forward and didn't? And if not, how can we make sure that we make have more impact the next session?
Mr.
Yeah,
Chair,
I think that's yes, go ahead, Kelly.
Kelly Marshall for the record. I think that's such an important point, Dr. Dixon, that you're raising. I almost wonder if that isn't a discussion for this subcommittee, but for the larger surge, that it's more philosophical. And I think the question right now, which feeds into it, is, what is still left to be done that this treatment and recovery subcommittee could tackle? And I don't think the answer is nothing. I don't think our work is done, I guess is what I would say. But I think your question about, like, how do we know and put this together and look at it both analytically and strategically, that may be a question for the broader surge to discuss in April. I don't think that negates, but it maybe it delays answering the question of, what's your vision for developing recommendations this year? There was a question about, should we focus on refining last year's recommendations or on creating new recommendations? It seemed to me that this subcommittee worked pretty tirelessly to really define recommendations from last year. And make sure that they were precise and said explicitly what the subcommittee intended. So I'm not sure whether refinement is the direction this group would want to go or creating new ones. I guess we'll wait for the survey to find that out. But anyone interested or willing in sharing a vision, it would be helpful for us so we can help craft agendas that meet your needs. And I see that Dr. Kearns has her hand up.
Thank you, Terry Kearns, for the record. I was just going to add to the conversation that in the response subcommittee, we did have the same conversation as Laura Hale has already brought up. And an example is, I think there were a few that had recommendations for BDRs, but not all do. Some are policy and procedural types of issues. And I use the example of that under some of the grants that DPBH pushed out this past year, they put as one of their requirements, if it touches on any of the things that came as recommendations from the surge, they would get more points, if you will, or more favor toward funding those types of recommendations. So that's one way. And another example that the response subcommittee looked at was trying to kind of harmonize the difference between the Good Sam law and the drug-induced homicide. And that's something we realize isn't going to get done. And our recommendation is to broaden the language to include other populations in that. Not going through this year, but we're going to follow that and probably refine the language and look at it for the next legislative session. But we had the same exact things and are going to wait to hear what's happening in the legislation, and then also to get our reports from Fund for Resilient Nevada and also from the SAPTA and the SUPTRA grants to see if any of our recommendations made it into what they're doing.
Thank you, Dr. Kearns. Just to add to our discussion, I wanted to read for all of you a list of some possible topics that are going to be considered at the full SURG meetings. Oh, I see them there. Starting with the compassionate overdose response with Dr. Carla Wagner, the interdiction of drugs.
Actually, Chair Shell, maybe I moved forward too quickly, but these were two topics that were specifically suggested for treatment and recovery. And I think we wanted to test whether the group agreed that we would move forward with these as presentations. In addition to anything that someone submits as a recommendation. And then I think, Chair Shell, in your notes, I had provided a note about Assemblywoman Thomas, our former member. She had made a recommendation, and I wanted to get direction from the subcommittee on that. So I think you're accurate in going back to the list that you were going to provide. These are the things that are going to be at the full SURG, and then maybe we'll go forward to that slide to talk about what the subcommittee wants to do with the recommendations for its presentations.
That sounds good, Kelly. Thank you. So referring to what Kelly just mentioned about Assemblywoman Thomas, she reached out to suggest that our subcommittee hear a presentation from Stacy Lockhart with Vegas Stronger on evidence-based opioid treatment and detox, including services for those experiencing homelessness. And for those of you that may not know, Vegas Stronger is now in the process of expanding to Northern Nevada, and will also be opening up Reno Stronger sometime in the spring. So I just think it's interesting to note that. I know there's been a lot of work done in Southern Nevada with Vegas Stronger that many of you are aware of. But would the subcommittee like to hear a presentation from Vegas Stronger, first of all? How does everyone feel about that?
Sure.
I see Dr. Dixon raising her head. Thank you, Dr. Dixon. Anyone, how do the rest of the subcommittee members feel about a presentation from Vegas Stronger? Okay, some of the
I would be
go ahead,
interested
Chelsea.
in hearing from them.
Okay, thank you, Chelsea. So just listing some of the other topics that are going to be on possible future agendas for the full SURG include legislative updates, including hearing on bills that were submitted, updates on the opioid settlement, the dissemination of the annual report, results of the annual member survey, compassionate overdose response, AB 19 additional members on SURG. As proposed, AB 19 adds the executive director of the Department 7 of Indigent Defense Services, one member of the general public, one person who is an emergency response employee, one representative of the Division of Child and Family Services of DHHS, and one representative of the Nevada District Attorneys Association or its successor organization. At a hearing on February 17th, 2025, additional members were suggested. This included someone from Clark County Public Defender's Office, someone from Division of Public and Behavioral Health, and people from multilingual households that have been affected by the drug crisis. And at the hearing, the Attorney General suggested getting input from current members and would like to discuss that in the subcommittee meetings as well as in the April SURG meeting. Other topics include the Clark County Regional Opioid Task Force, current trends in substance use, MOUD in rural jails, updates on crisis response centers in Washoe and Clark. And on that note, the Crisis Stabilization Center just opened in Washoe County, And the Crisis Stabilization Center for Clark County is in the process of opening in the next few months. And then the last recommendation was updates from the Department of Health and Human Services on the status and progress of recommendations made. So that's just not an all-inclusive list, but a list of some items that may appear on agendas for our subsequent SURG meetings. So on that note, Kelly, maybe moving on to the next slide, if we want to open it up to see are there any recommendations from our subcommittee members on any topics to cover in future meetings? And as Kelly pointed out, we had already talked about having Carla Wagner present on compassionate overdose response, and then also finding a speaker on the interdiction of drugs.
So,
And you'll
Kelly
see,
Marshall,
yes,
for
Kelly.
the record. So Chair Shell, I think we are interested in a speaker for interdiction of drugs. It sounds like, in addition, the subcommittee would like to hear from Vegas Stronger. So I will add that to the list. And then we will reach out to Dr. Wagner on compassionate overdose response. But we are interested, does any member of the subcommittee have a suggestion for a speaker on interdiction of drugs? And I see Dr. Dixon has her hand raised.
So, you know, I'm on the PAC board, PAC Coalition board, and we've always had Keith Carter from HIDA on our board. I don't know but I assume he's still a member, and I assume he's still from HIDA, but he's always been the person we go to for this kind of information.
So I can certainly add Kelly Marshall for the record. I can certainly add and reach out to him.
Chelsea, do you know, is he still is involved in HIDA as he was a year or two ago?
He is, yes. Mhm.
Okay, so he's kind of the person who knows what's going on.
And then Chair Shell, I do think that the Attorney General was specifically asking for input from current members and wanted that discussed in subcommittees as well. It will be discussed at the April SURG meeting. I see Dr. Kearns has her hand, so she probably has a better take on this than I do.
Now, your take is absolutely right, Kelly. Terry Kearns for the record. AG Ford at the Assembly HHS hearing on AB 19, when recommendations were made, AG Ford said he wanted to take it back. So he wanted to get feedback from the members before he agreed. And I just wanted to highlight a couple of things that Steve already talked about. As you know, AB 14 originally included having a member of the general public, someone from fire EMS, someone for Division of Child and Family Services or foster kinship, someone from the DIDS, the public defenders at the state level, and someone from the prosecutors. The recommendations were made that you heard, and Cody Finney requested somebody specifically from DPBH be on the committee. And then the recommendation was, as opposed to just a member of the general public, perhaps having someone bilingual from a household that's affected by substance use, someone from the Clark County Public or Defender's Office. And then also they made the recommendation about having someone who's in recovery and someone who deals with treatment of substance use disorder, which we did let them know that we already have those members on our committee, and highlighted that there's also the advisory committee for Resilient Nevada that also makes recommendations on the use of the funding for the Fund for Resilient Nevada, the opioid litigation funding. And I would also highlight that one of the committee members said that, why do you want to add more people? Oftentimes, the more people you have, the more difficult it is to get things done. So this is where the analysis that SEI did about the breakdown of those A through Q requirements from AB 374. And I went through the process about how those were assigned to each of the subcommittees, and that, you know, we have the 3 subcommittees, but we could probably have 20, but out of a funding and personnel issue, we are keeping it at those 3. And that the subcommittees do try to address those specific requirements. And that also looking at the special populations. The one thing about the special populations, to Dr. Dixon's point, is that people otherwise affected by substance use, we don't really know. So as we go forward, if you have an idea of how of a population, is to try to spell that out a little better, so it just doesn't go into that kind of big mass of people otherwise affected. And I did give the example that Clark County talked about with seeing with the homeless and heat related issues, as well as substance use related issues, was a special population that came out of their analysis that they weren't aware of. But not all of those members necessarily that were requested would necessarily get on here. And one comment, I know that Teresa, our chief of staff, was going to talk to Cody Finney, because right now we have Dr. Slamowitz, who's the director's representative. Then if we did have someone from DCFS and somebody from DPBH, that would be 3 representatives from DHHS. So that was some of the conversation about whether we wanted 3 representatives from DHHS. And then as highlighted, someone from bilingual, that's bilingual or a bilingual household. That became important. And then from the Clark County Public Defenders, the thought was too, maybe they should be working with Clark County and their opioid settlement funds from Clark County, because we already have someone at the state level that we're proposing from the Public Defender's Office and also from the prosecutors. So just to let you know, that was a little bit more of the conversation that went on during that hearing, and what the AG would like to hear from the committee members in that April 9th meeting. So please come with an idea if you would be in favor or not in favor of these additional people that we had suggested, or that were suggested at the hearing.
Thank you, Dr. Kearns. I wanted to note on the slide before you that at the bottom there, you'll see the next meeting dates for our subcommittee. So we have 5 meetings scheduled between before the end of the year. So we still have an opportunity to bring forward any topics, you know, for our future meetings, but we would like to be able to give the SEI staff, you know, plenty of time in advance to be able to schedule those speakers. Any other discussion regarding topics for our subcommittee or for the full SURG for that matter?
Yeah, this is Dr. Dixon.
Yes, Dr.
again.
Dixon.
So going back to something I was saying earlier, you know, the data that's been coming out, the overdose deaths from opioids is going down. If you look at an overall number for the whole country, but it's going down primarily in the East. I think more Northeast, and it's not going down in Nevada. And so what I really would be interested in someone who's really looked at that data and see why it seems to be going down in the East and not in the West, and what is really going on. What have they? Are there some programs that they have you know, done, or have they gotten a better control of the amount of fentanyl in the community? I have no idea. And so I think it would be interesting to know what success, what has created success.
Chair Shell, Kelly Marshall for the record. I see that in July on the list of presentations that you noted would be going in front of the full SURG, it looked like there were presentations on trends in substance use in Nevada and overdose as well. And so I think we could certainly request that those presenters answer or try to address Dr. Dixon's area of inquiry.
I think that sounds appropriate, Kelly. Yes, as you said, that's on the list of topics for the surge. Does that sound good, Dr. Dixon?
Yep.
Okay, thank you. Any other discussion from our subcommittee members regarding topics or speakers? Okay, hearing none, that will conclude item number 6 on our agenda. We'll move on to item number 7, which is to discuss the report out for the April 9th surge meeting. I will note that Attorney General Ford would like to, oh, yes. Was that someone? Okay. I would like to note that Attorney General Ford would like to hear from the subcommittees on the subject of new members, and we'll be asking for a vote at the April 9th meeting. And so I know a few minutes ago I shared with some of the other additional members that are being considered for the surge. So I know Attorney General Ford would like to hear from each of the subcommittees as to how we feel about that. So just to note that. Other than our recommendations for, well, the speakers that we're lining up for our subsequent meetings, other than that, does anyone have any other items that they may want us to include in the report out at the full surge? Okay, anything else to share on that note, Kelly?
You're muted.
Oh, Kelly, you're muted.
I apologize. Kelly Marshall for the record. No, just a note that I'm sharing again on the screen, the survey link for recommendations. If you don't have a fully formed recommendation, but you have a topic you would like to discuss with the subcommittee or a presenter, you can also make presenter suggestions on that survey linking link, and we'll send that out by email as well to the subcommittee after this meeting.
And then I also wanted to note that just depending on how our subcommittee members feel about the addition of members to the full surge, you'll certainly have the opportunity to bring up, any concerns or make any other comments at the full surge meeting. So if there's not any other discussion about our report out for the full surge, we will move on to item number 8 on the agenda, which is public comment. Please bear with me as I make another brief statement. Public comment shall be limited to 3 minutes per person. Members of the public may comment on any members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to subparagraph 2 of NRS 241010. So on that note, Kelly, do you see anyone wishing to make public comment?
I do not see anyone's hands raised, and nobody has pressed *6 and requested to be unmuted.
Okay, hearing that we have no one for public comment, that concludes that item. We'll move on to item number 9, which is our adjournment. We'll look forward to seeing everyone at the full surge meeting on April 9th, and then at our next treatment and recovery subcommittee meeting in May. So it was great to see everyone today, and we will see you all soon. Thank you again for your attendance.